Hi, welcome to our second video in our enterprise medical data management system. In the last video, we did getting started where we focus on system configuration, system setup. In this video, we will be looking at a medical examination. From the last video, we had created two users, one in the management group and the other in the doctor's group. We will be using the doctor's login for this video. So we'll just jump right in, log in as our doctor. And if you remember from the last video, the name of the doctor was, the username for the doctor was James T. And the default system password, ABC123. Now for every user, once created, there's a system generated password. However, at first logon, you are required to change to a unique password. So we click on OK. It's asking for the current password, ABC123. And what's your new password? For simplicity, I'll say 777. Submit. Right, so my password is now unique. And I can log in again as James T, our doctor, 777. Submit. Right, so here we are at our dashboard. Now before we can do an examination, we have to do a visit. So if I go to customer service, add a visit, all my customers pop up in the grid, and I'll use Mr. Alexander, so I'll just click on add. Personal data comes up, I can do vital signs, I'll leave the blood pressure as is, normal blood pressure. Weight is 60 kg, height 170, oxygen saturation 94%. Leave the temperature at the default temperature. Pulse rate is 60. Respiration rate, I'll set that at 13 breaths per minute. And the blood glucose at 70. The urinalysis, what I tend to do here, I tend to use a shortcut method. So I'll set everything in range, and then whatever is out of range, I just modify those. So let's say that the color was a bit cloudy. Now if I were to go back to personal data, I have the option, if it's a referral, I have the option to capture the name of the referring doctor. So let's say it's Dr. Grant. So Dr. Grant did the referral. So once I'm satisfied, I do a submit. I get my pop-up tells me everything was entered correctly. So do I want to enter another visit? For now, I'll say no. Alright. So immediately, my today's waiting list is populated with that visit that was just created. And of course, separation of powers, separation of responsibility, separation of roles. This visit would have been created by somebody from the admin group, and the doctor would now pick this up on his workstation. So we are also able to edit the visit, in case anything went awry. I can always go back and I can always edit, but we keep in as is. So once the doctor picks up this visit, do exam. So again, we get an overview of the personal information. Doctor can preview the vitals, the urinalysis, can preview if there are any changes to be made, the doctor can make those changes. Allergy NCDs. We could have set the allergies and any non-communicable disease from the customer record. But let's set it here. So in terms of allergy, this is a drug allergy. We have a huge listing of drugs. So we can filter. And the good old penicillin, for some reason, this particular customer is allergic to penicillin. So we can add the drug, okay. So that's added. A bit asthmatic and some amount of hypertension. Yeah, a bit hypertensive. So those are the allergies and the NCDs that we need to be aware of. Okay, now let's do the presentation. Presentation basically what symptoms are presented. Now we're greeted with an avatar, a male avatar. If it was a female customer, it would be a female avatar, of course. So once you click on a body part, symptoms peculiar to that particular body part pops up. So if I click on this, I see everything that's associated with the chest. Now, if there's a symptom that's not listed, we can go ahead and add that symptom on the fly. We'll do some of that when we look at the next video, but for now we'll just stick to what's in the list. So there's a barky cough, and the breastbone is tender to the touch. So let's go with those two for now. So you notice I have done the barky cough and the breastbone being tender to the touch. And this is what I was saying, if the symptom is not listed in the drop down, we could always go ahead and add that symptom on the fly. Yeah, there's a bit of pain in the thigh, the left thigh, so a left thigh injury we need to look at also. Now notice we can look at the front as well as the back. So depending on where the symptoms reside, we can basically look at the different sections. Alright, so we can add a note. energy seems, this is note to self. Like, COVID is popular, so we'll, you know, and this is a multi-line notes field, so we can put as much information as required. If it is we need to remove a symptom, we simply click on the trash bin and the symptom is gone. So we'll just stick with these two for now. Okay, so checkup. Now we can do a checkup based on the NCDs, or we can do a regular checkup, or we can do a medical. So we'll ignore those for now, and because we suspect COVID, we'll request that a COVID PCR-based test be done. It's in-house, so the results will be readily available, so I can always go in and I can edit the results. And this is a nice built-in WYSIWYG editor. So this should be at the bottom. For some reason it's coming up at the top. So this is a heading for my report. And I can say, so I can say tested positive. And I might want to put a little highlight here. So I can put, you know, as much as necessary. But for now, we'll just put that. And we can save. Examinations. What sort of examination did we execute on this particular customer? So we have a whole barrage of possibilities. And so basically we did a chest examination, and that was abnormal with all the coughing and all of that, so we can just add that. So ABNORMAL. That should be AB. Chest. And again, multi-line, so we put as much as we need to. Let's look at the lab screening. Lab screening, basically, if it is that you think a follow-up test is necessary, which is outside the remit of the office, so we can always send for any other test that we think might be necessary. So this is a predefined list. We can always add to the list. So for now, based on the coughing, let's send for a lung cancer test. So we're recommending a lung cancer test. Diagnosis. Now, this is where, if you remember from the getting started video where we mentioned some amount of intelligence, some amount of quote unquote AI. So this is where this comes into play. We can suggest a diagnosis. So if we click on the drop down, we say food poisoning and we say dandruff. Well, based on the information that was entered, I guess that's why dandruff coming in. Or we can look at all the possible diagnoses, which is what we add. This is not extensive. This is not a definitive list. This is just sample. All right. So we believe it's COVID. We're not seeing COVID. Remember, I told you we could add on the fly. So if I say new, and I say COVID, COVID-19 as my description. Gender, it affects all gender, both male and female. What are the symptoms? Coughing, fever, and I could put all the different, barrage of symptoms and I save. So once that is done, if I go back to suggested, I'm seeing COVID because of the cough that was a part of the symptom. So I say add the diagnosis. Follow-up required? Yes. Let's see him back in 2 weeks. The 31st, same time, end of the month. Sick leave, definitely sick leave. 14 days. Yeah, 14 days is good. Note to self. COVID-19. Diagnosed. Treatment. What are the treatment that we can administer in-house? Right now we have no treatment listed, but if it is, let's look at all the possible treatments we have. So these are all the possible treatments. So we could say hospitalization based on the extent of the COVID. So let's use that for now. So hospitalization recommended. Medication is allergic to penicillin, so we know we can't prescribe anything that might contain penicillin. We can look at the suggested medication. Based on the trend, nothing is suggested. Based on the symptoms presented, the diagnosis presented, nothing is suggested. That can be, modified, but let's look at all the possible medication. And we have a whole gamut. So, and the good old penicillin, but we know he's allergic to penicillin, so we wouldn't recommend penicillin. Is there any? No Panadol. Let's just choose one. This is for the coughing, just temporary relief. And we can say I'm not sure what that is, by the way, so don't hold me to that. We can say one dose twice daily after meal. Repeat for note to self again, multi-line. If this was our second or third or follow-up visit, we would have had some history. But seeing that this, we do have an history. We have some history. All right, so I think this is some test data that we're looking at. So we can look at what was presented. Nothing was presented. This was just some test data. So we can do a print preview, or we can let's continue the examination, but that will be populated with the previous visit, but that was some test data. Some tests was being run, some quality control testing. All right, so basically diagnosis, we're given 14 days sick leave. In terms of the testing, we're doing a PCR test, so we can submit. So the exact, you notice my appointment instantly populated for the next 2 weeks. So basically the examination was successfully added, and asking if I want to print the sick leave. I can say yes, print my sick leave right now. So this is what the sick leave would look like. If it was, there's also an option to address the sick leave to your employer, and that's in the customer table. The option wasn't selected. If it was selected, you would have seen the employer's information, name and address sort of thing right here. So this will print, and we basically stamp and sign and pass to the customer. So look, a pop-up, was it printed successfully? For whatever reason, we might have had a paper jam, or some information was incorrect that we need to change. We can always go back and reprocess. But for now, we'll say yes, it was printed okay. Do you want to print the test results? I can say yes, print my test results. So this is a test result. So with a positive test for COVID-19. Again, we print, we sign, and stamp, and pass on to the customer. Same pop-up, was the test result printed okay? We can say yes, it was printed okay. So in a nutshell, that's it for the examination. We have some reporting to look at, and we also have the lab work to look at. So when the results are the external lab results come back in, we are basically required to upload those results. So in our next video, we will be looking at reports and how we deal with results that comes in from external lab. So thanks for taking the time for watching, and see you in the next video.